Okay. Hi, everyone. Thank you all for joining. My name is Nishi. I'm the APhA Professional Development VP. I also have Dan Smith with us. He's the president-elect of NCPA, and I want to thank him for collaborating with APhA to make this event possible. The purpose of the event tonight is really to learn more about obtaining residency in community pharmacy. We have wonderful panelists with us tonight who are here to speak about their experiences and answers any questions that you might have. So please utilize them. We have Dr. Deanna Tran, Dr. Jessica Frazier, Dr. Paige Gilk, Dr. Allison Loy with us tonight. Thank you to the panelists so much for being here. We really appreciate your time. So tonight we'll just get to hear from each of the panelists, and then we'll have a Q&A session, and then we'll go into a small breakout rooms. So without any further delay, I'll ask Dr. Tran to please share your presentation with us.
Thank you so much, and thanks to APhA-ASP and NCPA for letting me come and talk with you guys about one of my favorite topics, which is community pharmacy-based residencies. So I'll go ahead and share my screen. While I do that, we'd love to hear, because I know it looks like we have about 19 people. Can you guys give me a thumbs up if you are a P1? And also, I would love to see your bright and shiny, very tired faces. There we go. I got a thumbs up. Awesome. Ooh, a lone P1. You are brave. Thank you so much for coming. All right. What about our P2s? Thanks, Dan. Any others? There we go. Thanks, Meg and Linfa, for turning on your cameras. And then the rest of you guys are P3s? Oh, I see Marjan. She's a P4. Do we have any other P4s? Awesome, awesome. Great, okay, cool. Now we get a lay of the land. Okay, now I'll share my screen. Okay, this is a very brief overview to answer probably some of your most common questions related to community-based pharmacy residencies. Sometimes my Zoom lets me look at chats and sometimes I can't. So I'll try to answer them all at the end, but feel free to put them in as you guys go if you have any questions. Okay. So to really talk about community-based pharmacy residencies, I have to first talk about community-based pharmacy clinical services. And why we have residencies, right? Kind of the basis for this is really that there is a huge movement of community pharmacy doing more ambulatory care and clinical services. And part of that is because there's a lot of needs in our healthcare system. Some of those needs include that 45% of Americans have at least one chronic condition. There are potentially 30 million uninsured people who enter our healthcare system. And this is a stat back from 2019. So you can imagine there's probably many more uninsured individuals in our healthcare system. So those patients, those individuals don't normally get preventative care, see a primary care provider, have preventative services that help keep them out of the hospital. So that's kind of why outpatient and community pharmacy can really help with that piece. You also have Medicare enrollees, so a lot more Medicare older population. And then by 2025, there's an expected deficit of more than 50,000 primary care physicians. So that means, again, looking and thinking about our rural population that needs more primary care providers, and in general in our United States that needs more primary care providers. This is why pharmacists and community-based pharmacists can really help with that need. So when we look at our healthcare system in general, we're also thinking about what are some of the aims that we're trying to reach. And some of those aims include improving access to care, improving quality of care, and helping to contain healthcare costs. So again, community pharmacists can really help with that. And that's kind of really what triggered this movement.
So really, as I was mentioning, we really are having a movement in our community pharmacy.
I don't know why that's talking right there. Okay, that's weird. Obviously, those are also slides for my ABL3 stuff. I wish I could go back to the slide without making that weird sound that it's making. But basically that community pharmacy, we started with doing a lot more dispensing, and then we started doing more counseling, education, MTM, and now where we are, which is this tipping point in community pharmacy in our profession to be able to do more services. And I think that's even more obvious right now during the age of COVID, right? Community pharmacists are really the ones who are doing immunizations, doing diagnostic testing, antibody testing, doing and providing monoclonal antibodies. Those are all services that community-based pharmacists are doing because we're the ones in outpatient setting and be able to do that. So here's just a kind of not an all-inclusive list of many of the different clinical services that we are starting to offer. And you might be thinking, especially in Maryland, right? When you go to a pharmacy, you don't hear a lot of these kind of services. And that's true. In Maryland, we don't have a robust amount of services, but it's definitely coming along. In the 11, 10 years that I have, since I've graduated and been a resident, we've been doing more and more services. And it's really great because we have 2 Safeway residents that can talk about how many clinical services they do in a pharmacy setting. I think that will also help a lot. So some examples include point of care testing. So being able to provide glucose screenings and cholesterol screenings and things that you might actually think about, like rapid diagnostic testing. So swabbing you for strep throat and then being able to offer you an antibiotic. So those are some of those point of care testing things that we can do. We also have MTM, or medication therapy management, immunizations, along with that, travel health services. So there's actually travel health vaccines and medications that you can offer. That was one big thing that I did during my residency, was travel health services. You can also do medication sync, where you sync all your medications for a patient onto one day. So that way it's easier for them, helps them with adherence. And also you can check better for drug interactions and duplications and stuff like that. In various states, including in Maryland, we can do contraceptive prescribing. Other states can do smoking cessation prescribing, and there's some other ones that are listed here. So just some examples of some of the services that community pharmacists are starting to do, and definitely our residents are doing. I feel like in Maryland, a lot of our independent pharmacists are doing a lot of these services because that helps them with reimbursement and helping with the patients in their communities. So what are the components of a community-based pharmacy residency? So like any other residency, there are 3 main parts. There's patient care, there's research, and then there's teaching. So our patient care section for community-based residencies is, of course, in a community pharmacy setting, and it's our longitudinal rotation. So instead of having like a 4 or 5 week or a month-long rotation, you're at a community pharmacy setting for the whole time. Now, depending on your setting, you might be going from, a pharmacy to a pharmacy if it's in like a chain or a grocery store pharmacy, but you're still in that one setting. And during that setting, you might have days where you're more focused on dispensing, and some days that you might be providing more patient care services. So kind of things that I listed here. In addition to that, you'd be doing other things like developing and enhancing services, developing a business plan to learn how to develop a service, being able to gain marketing skills and learning more about reimbursement, learning more about managing that pharmacy. I think those are unique pieces that are different from an ambulatory care setting, right? So in an ambulatory care setting, I wouldn't have to think as much about how do I market to patients so that patients can come and enroll in the services that I provide. And because community pharmacy is more business centered, we really have to think more about the compensation and reimbursement piece of that and the management of that pharmacy. We also have an ambulatory care setting. So all community-based residents are also required to be part of an AmCare clinic. So they may partner, if the pharmacy chain or whatever that might be doesn't have one, they might partner with an academic institution. So like, for example, Safeway partners with our university, and we offer our clinics, our AmCare clinics, for our residents to have their half day or full day there. And then we have research. So in a community-based residency, you would be doing research about community pharmacy. So I won't steal our limelight from our 2 residents so they can share what their residency projects was about. But mine was on travel health when I was a resident and looking at what some of the outcomes of our services were. And then for teaching, if they are part of an academic institution, they might already do teaching there, but if not, they might partner. So like, for instance, Safeway partners with the University of Maryland, and then they do their teaching certificate, they do all their teaching activities at the school pharmacy. Okay. So another big question is, why community pharmacy residency versus going straight into working? Now, of course, you can go straight into working, right? That's the same case for all types of residencies. You could. And in general, we say that residency is equals to about 3 years of experience in that one compact year. But what I think is really great about a residency is that it gives you a chance to train, to be mentored, to be coached while you're actually out on the field. So, of course, you get training when you first, let's say you decide to become a community pharmacist, you'll get trained to make sure that you feel comfortable with verifying prescriptions. But who's going to help you ensure best practices? Who's going to really make you feel even more comfortable managing a patient's disease state, making recommendations during MTM? So those sort of things, especially that management piece, is something that's really unique about having a community residency to help you along that way. In addition to that, which I really found unique, is be able to learn how to develop patient care services and how to implement those services and be able to take that to other places. So I did my residency in Virginia, and they have a lot of robust services. So I was really excited to bring that back to Maryland. That's one of the reasons why I became a faculty member. And then lastly, to become a leader and an innovator in community pharmacy practice. So again, getting back to that aspect of you trained at the highest level of what community pharmacists could potentially do. You have all the foundational skills to develop even more services, and you can take that and become a leader and advocate for community pharmacy in our patients. Okay, so what are some of the practice settings for a community-based pharmacy residency? So here are just some of the places that you could go. You could be at an independent pharmacy, you could be in a supermarket, you could be in a chain pharmacy, you could do a health systems pharmacy. Like for instance, some hospitals have residencies for their community residency. You also have like Hopkins is also kind of like a health system-ish kind of based community-based residency program. So each of these residencies, even though the foundation of what a residency program is, right, because it's ASHP accredited, they all have some unique aspects. So if you're really interested in a community-based residency, you have to think about, well, what do I really want to get out of the residency? Do I want to learn more about management? So maybe doing more independent pharmacy. Do I want to own a pharmacy one day? Another great reason to do independent pharmacy. Or maybe you don't want to worry about all the red tape, right? Like I want to go to residency and learn how to develop services. I don't have to wait for corporate office to come back, tell me all the issues, the red tape that might occur in developing a service. Another great reason to go independent. For a supermarket chain, one of the unique things that they have and can offer is that wellness piece. They do a lot more with healthy eating. They might have dietitians, stuff like that. So that's one unique aspect for supermarket chains. And then for chain pharmacies, as well as for supermarket chains, you can learn more about the corporate side of things and managing multiple pharmacies. And then for health system pharmacies, I think that there's just so many different types of health system pharmacy residencies. So I think that there's just a lot more unique opportunities there. You do a lot more specialty pharmacy. You might have more access to the HR system, for instance, are just some examples. And then if you didn't know, we actually have not just the PGY1 community-based residencies, but there are also fellowships where you do kind of like an academic research kind of based PGY1, PGY2, or you could do PGY1, PGY2, such as like an admin or leadership, along with a PGY1 community-based residency. So I think Hopkins has a PGY1, PGY2 admin as well. Okay. I think this might be my last slide. So what could you do after residency? And I think that there's kind of unlimited amount of what you could do with your community-based residency afterwards. But some of the probably most common things that pharmacists do afterwards is go straight into a PIC type role where they're becoming a pharmacy manager because they feel comfortable. And a lot of the residents that we have trained that I have worked with personally, they feel definitely very confident after their residency to be able to go straight into a PIC role, which is really great. They can also be a clinical coordinator, which means that they're coordinating clinical services for a group of pharmacies or a pharmacy chain, or they might be that person in charge of doing all the clinical services for a pharmacy chain, for instance. You can also have, which is becoming more and more popular, pharmacists who are hired to do part-time clinical, part-time staff pharmacists. So they might say like, you'll be 60% at the counter and 40% of the time you'll be able to do clinical services. A lot of our residents over time also become residency preceptors and coordinators and directors. And you could also become someone like me, like a faculty member. Oh, that was not on this slide. So this kind of, hopefully this is my last slide, is what is the difference between community pharmacy and ambulatory care? And I kind of alluded to this in earlier slides. But some other reasons, other differences between these two types of settings, I think one of them is patient population, right? So when you're in a community pharmacy, any patient that walks into your pharmacy, you could help them, right? You're kind of part of that public health system. You're helping any patient that comes by. Versus in an ambulatory care setting, you're typically helping in a referral type process. So you're working more closely with a provider or an office, and they would refer patients to you. So you see only specific type patients. So I think that's one big difference between these two. Second one is that business model piece that I talked about earlier. So community pharmacies are more business oriented because ultimately they're a business, versus AmCare, you might be supported by a hospital or a physician's office to provide those additional supplemental services. Then you have dispensing, right? In an AmCare setting, you're definitely not dispensing. And even though we're talking a lot about clinical services, and that's definitely the direction that community pharmacy is moving into, dispensing will always be there, right? That's like the bread and butter of pharmacy. Someone has to verify prescriptions, and it will almost probably always be pharmacists, right? And so someone has to do it, and it will probably be our community pharmacist. So that's not going away. So I like to tell students who are thinking about community pharmacy residencies, and then they're just thinking about, is it AmCare that I really love, or is that community pharmacy piece? I always ask the question of, do you like dispensing medicines? Because some people don't, and that's okay. But I think you have to think about whether or not that's something that's okay for you. Because dispensing is really a big part of community pharmacy. And I actually think it's an advantage. It's an advantage that patients come all times of the month, right? And you build a relationship with them because they're coming in to pick up their medicines. You're building a relationship with them because you're dispensing their meds. You know how things are going, you know about their families, they're chatting with you while you're dispensing. Those are the relationship that you guys build, which is different from an AmCare setting where you might be sitting down and talking to that one person. Okay, and that was my last slide. Lovely. And I will turn it back to our two hosts.
Thank you, Dr. Tran. That was really valuable information for our attendees today. Next, I will ask our panelists, the rest of the panelists, to introduce themselves. I'll share my slides in a few seconds. Are you able to see? Yeah, okay, great. Next, we have Dr. Paige Gilp.
Okay, hi everyone. My name is Paige Gilp. I am the one of the PGY1 community-based pharmacy residents with Safeway in the University of Maryland. I'm happy to be here with you all today. Get started. Oh, can you advance the slide, please? I don't have slide control. So I grew up in Northwest Indiana in a town called Lake Station. It's about 45 minutes outside of Chicago. I went to pharmacy school at Purdue, which is in central Indiana. And during my time in pharmacy school, and even before I got in, I worked at Meijer, which is like a supermarket chain in the Midwest. And I was there for about 5 years. So why community-based pharmacy residency? Kind of how Dr. Tran mentioned, it is beyond staffing. So the goal of this year is not to make you an expert in the workflow, because a lot of our time is spent doing patient care services. So like MTM, medication therapy management. Safeway has associate diabetes management program. So we can meet with associates at Safeway who have diabetes and help manage their diabetes right in the pharmacy in our patient care rooms. And then there's also like flu clinics and other patient care activities. Leadership and management is also a really big part. Just recently we had a 4-day-long meeting or 3-day-long meeting with leadership in Boise, Idaho. It would have been in Boise, but it was virtual. And there we got to present our business plans and receive career advice. Other leadership activities include meeting with our DPMs, kind of doing store visits with them, sitting in on annual reviews when they review the performance of pharmacy managers. Also, I got to work with my residency program director. She's also a patient care services manager, and she schedules like the flu shot clinics, and I got to help her with that. And I think moving on, the new service plan or the business plan is really unique to the PGY1 community because a lot of residents don't see that until their second year of like a PGY2 that is specialized in AM care. So I think it's really cool that we get the chance to do that now in our first year. Also, there will be research and the teaching certificate and teaching activities. And we have a really supportive and great research and teaching preceptors. So that's been a really fun part of it. There's also ambulatory care clinics. Right now, I'm at Mercy Clinic in Gaithersburg, Maryland. It's a really unique patient population. About 85% are only Spanish speaking. So we get a lot of practice with translators, and that's really rewarding experience there. Also, there's an opportunity for us to become HIV certified pharmacists. So we're currently working on that right now. There's also additional rotations and specialty or managed care. I just started specialty last week, and I'm working on developing some patient counseling forums that are patient friendly. So when the pharmacist is doing their counseling, it's very at an 8th grade reading level or below. And then lastly, there's opportunities to volunteer. Allison and I were able to go to the In America Remember event at the Washington Monument.
Hi, everyone. My name is Allison. I am Page's co-resident. So I'm the other resident that's doing the community base with Safeway Albertsons and University of Maryland. So a little bit about me. I am from Denver, Colorado. I have on here just a few things that just to tell you more about me. So in my free time, I like to do pottery. This is my cat, Wally. I miss him, so he's back in Colorado. And then I always have to start with a cup of coffee in the morning, or I am not able to get started. So next slide, please. So a little bit about my education and where I'm from. So for undergraduate, I went to the University of Denver, that's in Denver, Colorado. I got my Bachelor's of Science degree in biochemistry. And then before starting pharmacy school, I went to the University of Colorado Scout School of Pharmacy and Pharmaceutical Sciences, which is also in Denver, Colorado. I was a technician, pharmacy technician at Walgreens Pharmacy, and then I transitioned over to intern. So I was at the same store for all, I did that a total like 5 years. So great experience. That kind of brings me to my next point. Next slide, please. My pharmacy manager at my Walgreens pharmacy was one of the reasons why I wanted to pursue a community-based residency. Just seeing her interactions with patients and seeing the difference that she can make really just kind of like sparked my interest. And then specifically why I chose Safeway Pharmacy, moving beyond that chain pharmacy and moving into the grocery store pharmacy was because of what Dr. Tran was saying. Like, you're able to really see those patients, not just when they need you, like when they're grocery shopping, they will, like, I see it now at my community site where patients are just walking by and they're saying like, hi to the pharmacist, because you know, that's the person that they go and see to pick up their meds, but they're grocery shopping on a daily or not a daily basis, but whenever they're seeing the pharmacist, they're always happy. So that was one of the main reasons why. And then the second reason why community-based pharmacy, specifically with Safeway, was because of all the different certifications and different activities that you would be participating throughout the year. So like some of the services that we are able to provide are like travel health services. So we take a course, the APhA course, and then we get a certification. So we're able to provide the service at our community site, along with diabetes care, just having that additional foundation. And then
being able to provide that service. And then as Paige mentioned, here in our division, in the Maryland, in the Mid-Atlantic division, which encompasses like Maryland, Virginia, and Washington, DC, HIV's the incidence prevalence is large here. So we're able, and also since we have the service here, Paige and I are getting our certification for that. So we're able to provide that more comprehensive care for the HIV patients. So those are just some additional certifications that you'll be able to do if you pursue community-based residency and provide that extra like clinical service while being accessible to the patients at your pharmacy. And then just to go through some areas of interest of mine are medication safety, quality improvement. So one of the projects that we will be working on later on in the second half of the residency would be looking at a quality improvement project in terms of anything like workflow related or operational related. And then specialty care, as Paige mentioned, it's one of our, it's part of our patient care longitudinal learning experience, but having that additional like patient population that are specialty related. So those are some of the reasons why I chose a community-based residency.
All right. Hi, guys. My name is Jessica. I am a graduate of University of Maryland School of Pharmacy. During my time there, very involved with NCPA. I've always loved community pharmacy. I actually got my first job ever in high school at my little local independent pharmacy right down the street from my high school. I would go after school and work up at the front, and then eventually moved back to being a technician. I kind of knew that I wanted to go to pharmacy school. I was very interested in it, but I said, you know, let's try it out before I go through 8 years of schooling and then end up not liking it, right? But that was not the case. I absolutely fell in love with independent pharmacy. So kind of from day one in pharmacy school, I kind of knew that's where I wanted to go. Residency, however, was a different story. I was almost kind of convinced I wasn't doing a residency. I didn't know much about it. I didn't even know they existed for community-based residencies when I first started pharmacy school. But then, you know, just by going to these types of events, I learned much more about them and learned their true benefit. And I think it's a very personal decision on if you want to do residency or not. For me and my goals, specifically, you know, I would love to own my own pharmacy one day, and if not own, I would love to manage or just be a PIC of an independent pharmacy. And to get there the quickest way possible, I thought that doing a residency would help me get there. So I was able to find this amazing program at Terrytown Pharmacy in Austin, Texas, and they are specifically an ownership and management residency. So that was kind of the main focus. So like Dr. Tran was talking about, every community residency is going to be different, and you want to make sure you find the one that's best for you. And I was able to find this awesome program that is actually unaccredited, and that's almost intentional. It really is intentional because a lot of there's benefits, of course, there's pros and cons to both accreditation and non-accredited. And for me specifically, I wanted to find a program that was really geared towards my goals, specific to my goals. And some of the ASHP accreditation requirements kind of can take away from some of the other things that I wanted to learn, like management, the financials of owning a business, all of that. So that's something to consider. But I'd say most programs are obviously accredited, but if you want to do the ownership or management route, I implore you to look into some of the unaccredited programs because there are some amazing ones out there. A really good place to find them would be at the NCPA conference, actually, at the residency showcase. All of our little independent friends stores around the country, we get to come together and you can learn a lot about the programs there. If you want to go to the next slide. So I just put together some pictures here. These are all pictures from when I did my residency. I just finished at the end of June. I just wanted to kind of highlight some of the amazing things that I was able to accomplish in residency that I definitely would not have been able to experience going straight into working. So that top left orange picture up there, that is me giving a lecture at the University of Texas School of Pharmacy. I was able to be a teaching assistant for their community pharmacy management course. I taught a lecture about inventory management. And that was just one small portion of the teaching certificate that I was able to get through being associated with UT. Kind of in the middle there in my PPE, of course, I did my residency in the height of the pandemic, and I was actually able to start from the ground up a brand new COVID testing service. And we went from doing 24 tests a day to opening 5 locations and doing thousands and thousands of tests a day. And that's just one little independent pharmacy. So that was a really, really cool experience. You'll see some pictures of me giving vaccinations there. I was able to travel across the entire state of Texas, which is huge, to give vaccinations to the IDD community, the intellectually developmentally disabled, through a grant and contract with the state of Texas Health Department. That was really amazing. And I led a team by myself of 7 people in a little van. We were driving across the state. And then lastly, down there on the left is me, my RPD, and another gentleman who's really involved with Texas Pharmacy Association. We went to the Capitol and we did some amazing advocacy. We met with some of the senators and delegates. My RPD has actually testified there at the Capitol for some pharmacy topics. So those are just a few of the amazing things that I've been able to accomplish throughout my residency. I think it is an amazing experience. I would implore you to look into it, find the program that fits you and your goals specifically, because every single one is so different. And whatever you want to do, I promise there's one out there for you. It might be hard to find, but it is very worth it.
Thank you so much for the introductions. Next, we have the Q&A section. So the students were able to send in some of their questions. We'll go ahead and ask you all to answer some of the questions.
Alrighty, so first question we have is, how did your residency help you as a faculty member? And that one might be for Dr. Tran.
The only faculty member at the moment. So my residency helped a lot. So we had a teaching certificate program. So my residency was down in Richmond, Virginia with Virginia Commonwealth University in partnership with Martin's Pharmacy, which is the same chain as Giant here. So during my time as a resident, I completed my teaching certificate program. I precepted students, I did lectures, and all of those things was really kind of what inspired me to change what my goals were. So I came in to residency thinking that I want to be a residency director and be a clinical coordinator. And through my time as a resident, that inspired me to become a faculty member, because what I really loved was sharing my experiences about community pharmacy and being a great advocate, and being able to share that with students and being able to help continue the advancement of community pharmacy. That's kind of what I love about being a faculty member. So that's kind of why I came back after I finished my residency and came back to the University of Maryland to be a faculty member. The cool thing too was that at the time they were offering a faculty position, a community faculty position with Giant Pharmacy here in Maryland. So my transition from Martin's Pharmacy to Giant Pharmacy was super smooth because I was basically already in the system. And the difference was huge in terms of what they were doing in Virginia versus what they were doing in Maryland. When I started as a faculty in Maryland, Giant Pharmacy was doing basically no clinical services. So I helped them start their MTM services. We start diabetes classes. So anyone who has been working at Giant and has heard about their diabetes classes, those were things I started as in my first year as a faculty member. And that's what I love. I love that opportunity that the residency really offered me and gave me confidence in being able to do.
Awesome. Thank you so much. And it looks like our second question is, what are we going to gain from community residency program, and in what ways is having community residency helpful? And I think Dr. Fraser, you mentioned also that it was sort of specific to what you want, but I'm curious if you were still trying to pursue maybe ownership one day, since you said that was something you might be interested in.
Yeah. So to answer this question first, what you would gain from a community residency, and if I could put it into one word, I would just say experience. And I don't mean like logging hours and by the end you've worked 50-hour weeks for a whole year. Not so much that kind of experience, but just like life experience. I mean, you learn so much. And Dr. Tran alluded to this earlier. It's actually a really great transition period too. I mean, you have your rotations and you have your preceptors, and they're really there to guide you. If you go into community right out of school, not as a resident, you just are, go into being a pharmacist. Like she said, you definitely train and they help you get started, but this is much more of a mentorship almost. And it was a much smoother transition. And personally, the first time, like I was on the bench and it was like my first time to close by myself, like I really felt ready, but it's a scary transition. It really is. Like when you really think about, like, you've got patients' lives in your hands, like this is what we've all been waiting for so long, going through pharmacy school. And I think doing a community residency really gave me that enriching experience. And to answer your question about the ownership, yes, I definitely would love to own my own pharmacy one day. What's appealing to me about ownership is just all the benefits that come with independent pharmacy. We all have this dream about how we want to take care of our patients. And I think the best way to do that is through independent pharmacy, because you get to do it your way. No matter what you're doing as a pharmacist, you're going to help your patients no matter what, no matter the setting, you're going to be doing an amazing job and helping people. But in independent pharmacy, you get to do that in your own way. And that was it's really inspiring to me, and to see other colleagues that own their own pharmacies, or even just manage, PICs of independent pharmacies have, so much, potential with what they want to do. I mean, the pharmacy I work for now in Austin, I mean, we are so innovative, and it's just because, we say yes, like we have the capacity to just say yes to things. Like when the state came to us and said, hey, can you drive around the state and vaccinate, in these little tiny underserved communities for this really almost forgotten about population, no one else could do that. No one else could say yes. But as an independent pharmacy, you get to say yes. And that's kind of really fun and really exciting.
That's really cool. I really agree with your testament to kind of being able to craft your own pharmacy. I'm really excited. I am interested in that as well. And I'm excited for our business plan competition this year for NCPA. So
Nice.
that's a shout out plug for that. Whoever's interested should message me, because I'm really excited for that.
Business plan's amazing. I love business plan.
I'm excited to get started. This is gonna be my first one. Hopefully it goes well. We'll see. Alrighty, so third question we have are there opportunities to get involved in innovation projects related to community pharmacy practice while in residency?
Yeah, so great question. There are tons of opportunities. It just really depends on how much you want to take on. My research project is assessing or evaluating fourth-year students, and if they're ready and willing to provide medication administration. That's already allowed in Virginia, and it's been going on there for quite some time, but it is now approved in Maryland as well. So we want to get pharmacists and interns providing those services, such as like long-acting injectable antipsychotics, Vivitrol administration. My business plan is on pharmacists prescribing prenatal vitamins in Virginia as well. So that was recently just approved, and we're just getting that business plan formulated, and we hope to pilot it in one store in Virginia, hopefully by January or February. So really excited about that. Also, I mentioned when we had the leadership meeting with all of the Albertsons residents, last week. So I have like 14 or 13 other co-residents across the country. So I got to hear all their business plans. They were all great projects. One that I really liked was in Idaho, and it was pharmacists prescribing acne medications. I thought that was so cool because if that was available in my state, like last year, I definitely would have went and like pursued that service like as a patient. So I'm really happy to hear that like they're very innovative and pushing forward in Idaho especially. So yeah, there's a lot of opportunities. Just be open and ask your RPD, and just really be open with what you want to pursue.
Awesome. Thank you very much, Dr. Gilt. And we have our fourth question. What does your typical day look like?
Okay, so a typical day, I would say there's no 2 days that are the same, but I'll just tell you like a typical week and then a typical day within that week. So almost all of our learning experiences are longitudinal, so they're all going on at the same time. 3 out of 5 days we're at our community site. So mine is in Parkville, Maryland, and then Paige is in Rockville, Maryland. And then one day we're at our ambulatory care clinic site. That's either, I believe both of our sites are full days. And then the other day is split between teaching responsibility / research / project day. So within those 3 community days, we're at our site. So we're the second pharmacist. So you're never, you're involved in workflow, but you're doing more of that clinical services. So that's either appointment-based services or other services such as like travel health. You're providing immunizations. In Maryland, we're able to prescribe oral contraceptives. So if the patient comes for that, you're able to do that. Other services include, like Paige mentioned, our associate diabetes program. And then since we're that second pharmacist, we have that extra time with patients. So if a patient is new, just like had a new diagnosis of diabetes and they're not sure how to use their glucometer, that's something that as residents, we're able to take that time and really provide that education piece. Other patient care services that we would do on those days would be like MTM, calling patients, making sure they're adherent to their medications and seeing if they have any questions. And then HIV adherence. So making sure patients have their medications, that they're on track, that they're like a refill reminder, and if they have any questions. So those are some of the patient care services. Otherwise, we're helping with workflow and you're learning and developing those pharmacist skills as a community pharmacist. And then for the ambulatory care clinic days, Paige introduced her clinic. So my clinic is the mobile integrative health clinic. So it's with the University of Maryland Medical Center. So I'm there once a week, so able to look at patient charts using Epic, and then having that Zoom conference with the care team to provide that pharmacist piece. And then for teaching responsibilities, I see some of you guys on the call. So one of them would be being a facilitator. Other times we're like either guest lecturers and then working on our research project. So dividing that day. So that's kind of the typical day / week of what it looks like. Yeah.
Thank you, Dr. Loy. Sounds like it's a pretty busy schedule. Sounds like a lot going on. All right, and our last question, what are the skills and leadership positions the Community Residency Committee usually looks for?
Dr. Gilk, if you wanted to jump in and answer this one.
Sure, I can start with this one. So I think for skills, I don't know if there's a particular one. I mean, you definitely want to be passionate about community pharmacy and definitely about doing the residency as well. It shouldn't be something that you're kind of on the fence about because it does take a lot of dedication. So I would say just really be committed, definitely want to be, focused on providing that patient-centered care. It should be something that you really enjoy, I would say. definitely be flexible and open-minded, ready to, take on new roles. I would say teamwork is a really big skill to have. You'll be working with a lot of different people, a lot of different settings, and it's really important to be able to collaborate with the team to, get the achieve the outcome that you're wanting to achieve. Leadership positions, is this meaning more like during pharmacy school?
I think so, yeah.
I'm pretty, I guess, different in a way. I didn't really have any leadership positions during pharmacy school. I would say at work, though, I kind of had a lot of, not autonomy, but I was able to, I was really involved with the medication synchronization program at Meyer. I was able to develop a workflow on how we would recruit more patients. So that was kind of something that was like a leadership position in a way. Allison, I'll let you share.
Okay, yeah. I agree with everything that Paige said. I think in terms of what I would think a community residency committee would look at is that you really want to be in the community setting. So thinking about there are other experiences that you'll be having, but most of the time you're going to be at that community site. So wanting that direct patient interaction is really important. Because for most of the residency and your learning experiences will be direct patient care. And as Paige said, really wanting to be in that environment, I think is really important because a year may not seem like it's a long time, but it is a long time. So having that dedication and the commitment, I think, is really important. In terms of skills and leadership position, I think just showing your best self, on your CV, we all have done different things, and it's just highlighting, even if you've only had one leadership position, what did you do in that position? How is it meaningful for you? I think that's really important. So highlighting that experience, I feel like it's quality, not quantity, that the residency program would look for. So really just highlighting that during in your letter of intent and your CV, bullet points, I think is really important. Other leadership positions, whether that's research, I think it would count as leadership because not everyone has that experience. Depending on what you did with that experience, it counts as leadership. And Paige mentioned she was leadership during her work experience. So I think, again, it's just what did you do and how is that meaningful? You can spin it in a way that makes it impactful on your CV and your letter of intent.
Thank you so much. So we want to see if anyone else has any questions. I know Dr. Tran, you wanted to ask a question. So if you could, go ahead.
Sure, right before I do that, I just want to add to that last question, just because I sit on a residency committee. What I want to also emphasize is to definitely be yourself, because if all of the people who are applying are all the same, what they're going to end up looking at is your personality. So you want to be confident in who you are and try to show who you are to the residency committee, because then ultimately in the end, the residency director has to hang out with that resident for the entire year. So they want to know if they like you and that you'll like them. Okay. And that's really a big part of the matching process. If you decide to do a residency, that is part of the accreditation process. The other thing I would say that we look a lot at is things that we can't teach, right? We can teach you and improve your knowledge skills, but we can't teach you things like being professional or having decent, good time management skills or being a people person, because that's a big part of community pharmacy. So think about those characteristics and how to build that into your letter of intent and talking about that when you're on interviews. So yeah, definitely be honest. I think is my last big one before I move on, is be honest about what you want to do. Because we have definitely had people who apply and they tell us they want to do community pharmacy residency when they grow up, And then we also learned from a colleague that they also applied to a hospital residency. Pharmacy is very small. I'm sure you guys have heard that a lot. And we talk amongst all of our residency programs, community or not, especially in the Maryland area. So please just be honest about what you want to do. And if you are thinking about going into community pharmacy residency and then applying to a PGY2 in AmCare or transitions of care, we've definitely had different residents who've done that in our various residency programs that the University of Maryland has partnered with. That's totally cool. That's awesome. That's definitely a growing trend. Just be honest about that. So that way the residency director can see whether or not that matches what they want to do. Okay, so anyway, my big question for our 3 other speakers is something that I hear a lot, which is when, especially incoming students, they'll be like, oh, I'm thinking about between clinical pharmacy and retail or community pharmacy. So I want to hear from our 3 speakers what they think about community pharmacy and whether or not that's part of clinical pharmacy.
I love this question, Dr. Tran. It's like a little bit of a pet peeve, you know. They're like even just when I was at NCPA back in October, and we would talk to the students at the showcase, and they would talk about, they would distinguish between clinical pharmacy and community, like they were 2 completely separate things. But I think it's really important to remember that just because you're going into community pharmacy doesn't mean your job isn't clinical. I mean, you all day, every day, everything I do is clinical. You know, we have so many services, and especially if you want to do a community residency, that's what your whole life for a year will be, is dealing with clinical services. So don't let people tell you, you know, you're either going clinical or you're going community. Like, they're 2 different things. Because I mean, there's difference for sure between a hospital-based, you know, versus community, but our jobs are just as clinical.
Dr. Gill, did you have anything to add?
Yes, so I would say every day we are doing something clinical, especially while dispensing, checking the drug utilization review. There's things that come up and you have to know what's clinically important and what's not. And you have to decide that in a pretty timely manner. It's a little bit uncomfortable right now, something I need to work on. But you definitely are, there's so many patients that approach me during my time in the pharmacy, and they need recommendations, and there's a lot of things to consider, like before you make those recommendations. I would also say sometimes it feels even more clinical, because I know in a lot of hospitals they might have like protocols already typed up and stuff like that, which is really valuable to have. It's great for like patient safety, but sometimes, like in the community pharmacy, or most of the time, we don't have like a chart to refer to. So it's really like us doing our own digging, and like you really have to be confident in your answer. But also we do have support too. So if we want to send off a drug information question or talk to like our patient care pharmacist, they're always there for us, and like we can consult them on like things that we're not sure about.
Thank you. How about Dr. White?
I would say in terms of, yes, clinical every single day. Because if you think about like some of the clinical services that are offered at the community pharmacy, like oral contraceptive prescribing, like that's clinical, that's incorporated into workflow. So if a patient comes, like your state allows it, a patient comes, like that's clinical. You're going through a protocol or not, and you're making a clinical judgment to prescribe or not. Other clinical service like immunizations, that's clinical. You're looking with the information that's provided to you, looking at your dispensing software and looking at the state immunization registry, patient's disease states, you're making that recommendation. That's clinical. Other services, Paige mentioned in Maryland, we're able to, med administrations come in and we're gonna be doing it. So for at least State for Albertsons, that's going to be rolled out. So that's another clinical service. And then travel health, if you're able to, you have that certification and your pharmacy is able to provide that service, patients are going to be coming to you, and you're not only looking to see where they're going and what immunizations they need, but you're also making self-care recommendations for them to help protect them. Like if they're going somewhere that they need like insect repellents or other non-farm recommendations. So a lot of clinical is happening every single day, I would say, just in a different form than a hospital community or a hospital pharmacist would be doing inpatient, but still very clinical.
Thank you all for your great input and for the amazing conversation that we had. We are a little bit out of time, so I just want to open up the floor to our attendees and see if they have any questions. Don't be shy.
Yeah, I can ask a question, Nishi. This might be more to Dr. Tran. So if the practice size doesn't have like a collaborative practice agreement, like do residents also get to like building up the agreement together, or is it really depends on how tough it is?
Yeah, that's a great question. So I actually did both. So I was at a clinic where we had a collaborative practice agreement. So I had a chance to actually use it and be under my name as under that collaborative practice. But actually part of I had two projects. I had to do a business plan and I had to write a collaborative practice agreement so that I had the opportunity to learn how to write one. It's actually not that hard. There's a lot of good templates out there that you can use. So yes, you can absolutely do that. And you can also do that because getting back to that innovative piece, right? Community pharmacy is all about innovation, and so is the residency. So you could say, hey, I have this really cool idea and I want to make that my business plan to have a CPA along with it.
I have a question. Thank you, Sean, for asking that question. I have a question. So if we wanted to do, let's say, a community residency, and then go into maybe doing clinical work or clinical residency or vice versa. If I started off with clinical and then I want to switch to community and I want to start with community residency, would that be a possibility? I can ask that to Dr. Frazier or Dr. Tran.
Yeah, I think that that's definitely a possibility. You know, your career is what you want to make it. There's no rules. I mean, this past residency application period, I had the pleasure of sitting on the advisory committee, and we did have someone come apply to us after they had been at a different position for a few years at a pharmacy school. They decided they wanted to pursue something different, and frankly, that definitely didn't shine negatively on them. You know, they were coming to us with a couple years experience and a whole new, you know, perspective as well. So I don't think it is a negative at all if you were to switch. I don't know if Dr. Tran has anything else to add, but that's kind of my
Yeah, I agree with Dr. Frazier. I think there's, like I kind of mentioned earlier, there's a growing trend of people applying and doing PGY1 in community and then doing AmCare because they're so similar and you kind of build the foundation in PGY1 community. But again, just be upfront when you apply. There's some examples of residents that I've actually precepted myself that have gone on and done other things. So I've had a PGY2 that in transitions of care, a PGY2 in AmCare. I know of a very dear friend from VCU who finished her PGY1 in community and realized that she loved that research, which is like 10% of our entire year. And she fell in love with research and then took another 6 years doing her PhD. So do whatever you like. The sky's the limit.
Thank you so much for answering that. Any other questions?
Yeah, one question. So I know there's a lot of movement in terms of like Flip the Pharmacy. Our school has an APhA rotation with Flip the Pharmacy. Do residents get involved in that? And are there funding opportunities to work on some of the projects with them?
What a great question, Meg. That was a great segue to say, if you haven't applied, it's a great decision.
Yeah.
Please come, do Flip the Pharmacy. So yeah, there are tons of spots left for Flip the Pharmacy if you are interested in doing that for part of your rotation. So it's a clinical track, it's 2 rotations. So you learn more about management and clinical services. Are there residents involved? The unfortunate answer is no, because the University of Maryland right now is really just partnered with Safeway. And Safeway residents, as you can already tell from Dr. Lowe, Dr. Gilk, is like, they're so busy. So unfortunately, they're unable to help. We are actually exploring other options of trying to start residency programs again with our independent pharmacies. We used to actually host like 3 to 4 different independent residencies with the University of Maryland. So that is in the works, but probably not in the next few years, at least with everything going on.
I have, I can't remember the program, but we met them at NCPA, and their RPD is really involved with Flip the Pharmacy, and they actually have their residents help get pharmacies started with Flip the Pharmacy. So like I mentioned earlier, every program is going to be different. If that's something that you're really passionate about and you want to be that person for pharmacies to help them mentor them through the Flip the Pharmacy process, there's definitely programs out there like that.
Thank you so much. I think we are out of time, but I would like to take a quick picture really quickly for our social media pages. So if everyone wanted to come on camera and smile, I'll take it in 1, 2, 3. All right. Thank you all so much for coming today. We really appreciate, especially the panelists. Thank you so much for your time, and the student pharmacists that are here. I hope it was a very informative session. And all the student pharmacists, if you have any questions, please, of course, you can reach out to Dr. Tran, but if you want to connect with the residents, please reach out to me or Dan. We'd love to connect you. Thank you. Have a good night.
Thanks, everyone.